Hello, I'm Dr. Devane Glynn from University Hospital Limerick. Today I'll be presenting a case report of a spontaneous splenic rupture in a 23-year-old male. First, I'd like to start with an overview of the topic. Spontaneous splenic rupture is a rare but life-threatening condition, accounting for less than 1% of all splenic ruptures. It's commonly associated with infections, neoplasm, hematological disease, with idiopathic ruptures being exceptionally rare. Patients present with a range of symptoms from mild abdominal pain to hemorrhagic shock, and these can often lead to emergency interventions. In our case, a 23-year-old male presented with abdominal pain, lethargy, pallor, and a 2-week history of general fatigue and malaise. Initially, he was vitally stable, had generalized abdominal tenderness, and his labs were unremarkable aside from a mildly deranged liver function test. However, in the emergency department, he began experiencing transient loss of consciousness. An urgent CT with contrast showed a ruptured spleen with hemoperitoneum. He was brought to the emergency theatre where our massive transfusion protocol was started. He was anaesthetized and required blood products and vasopressors to maintain perfusion. The emergency laparotomy found over 4.5 litres of blood in his abdomen. Total splenectomy was performed and hemostasis was eventually achieved. He was successfully weaned off vasopressors and was extubated, subsequently making a full recovery. As I'm sure you're aware, spontaneous splenic rupture is quite rare and its etiology remains unclear. There are many possible mechanisms proposed, such as vascular anomalies, microtrauma, and raised intrasplenic pressure. Unfortunately, its non-specific presentation can lead to delays in diagnosis and treatment. Timely diagnosis is key, with gold standard being a contrast-enhanced CT. Management can be conservative in stable patients. However, definitive treatment for those unstable is a splenectomy. In conclusion, spontaneous splenic rupture is a rare but critical condition. A high clinical suspicion is required for timely diagnosis and management. And finally, we hope an increased awareness may aid early diagnosis and prompt further research of potential risk factors. Thank you for your time.